We are going to be talking about air quality and sanitation technology. I like to call this from NASA to nanotechnology. Now, I am going to assume that many of the folks who come on today are interested in a conversation around sanitation because of COVID or SARS-CoV-2, the virus. But I want to note that this conversation has been important to schools for a very long time because, and this is the reference up in the top right-hand corner of your screen, the number one of the number one reasons for absences amongst students and actually amongst teachers is asthma. And then after asthma, it's regular cold and flu. So even before COVID came along, this issue was a real issue driving whether or not kids were inside the classroom. That said, I want to note that there is some updated data. We'll actually send you the presentation. I'm also going to talk about, and I'll send you a copy of a report out of the University of Wisconsin-Madison that found that with continuous air pathogen reduction, and the emphasis on that word continuous that I'm going to show you, they actually reduced the presence of SARS-CoV-2 by 99.99%. So in the presentation, it's like says 92 or something from an earlier study, but they have a new data that shows that essentially the continuous system really cleaned the environment of all of the SARS-CoV-2. But that said, let's begin by thinking about the environment, because that's really what Meteor is about. And Meteor takes this very expansive idea of the environment. So Meteor Education partners with educators to design, plan to scale, deliver, install, and then support high-impact learning environments. And at the foundation of a high-impact learning environment is, of course, the idea that that environment is safe, that that entire environment is clean, right? They represent more than 200 manufacturers and partner with folks, for instance, like Dell Computer, the Center for College and Career Readiness, which I chair, University of Southern California, Rossier School of Education to do graduate courses, for instance, in trauma readiness, and then the Casper Group. And I'm especially talking about the Casper Group today. When you think about what we have to consider to create a high impact learning environment, Meteor believes that you want to have what they call a design meld, and that is bringing in many different brains into the conversation. So I might have an interior designer, but I absolutely want to make sure I have educators. And in this particular instance, I want to have some scientists who know something about air quality. Meteor does a lot with technology. This is an example of an active, engaged classroom. This classroom is actually designed explicitly for a particular kind of interaction in science and technology. They do a lot of work in cafes and cafeterias, not just the idea that I'm going to create a really interesting cafeteria, but specifically to drive food program participation by students. Their number one consultant actually comes from Walt Disney World, where he did that before he went and did things like radically increased food programs at really large districts, Orange County, for instance. Media centers are transformed at Meteor with the consultation of the American Association of School Librarians, how you really infuse technology into the media center to make it ready for whatever is to come, right? We don't know exactly what those jobs are going to be 10 years from now. And then lastly, looking at a variety of other kinds of environments, like here you have an esports gallery designed in part with Dell Computer. And then you have also outdoor spaces designed not just to be a play space, but in this case, to be a leadership development space. Now, if you think about air quality across all of those kinds of spaces, none of them operate the same way, all right? You really have to have someone who understands how to clean the air of pathogens if you're going to be in all those spaces. And by the way, cafeteria, you think about the amount of time it takes to cycle through air in a cafeteria, that might be very different than the time it takes to cycle through air, for instance, in a classroom. Right now, I know that we are all concerned about COVID. And I want to note that every previous health crisis has led to lasting changes in the built environment. Absolutely true. For instance, after the Spanish flu, you had white wipeable tile. You call it subway tile, probably. It became ubiquitous because they were just learning about how you saw dirt. When you get the presentation, there are a couple of really interesting articles I put in here. One is about the impact on architecture and thinking about social distancing. And then the other one was from Slate, and they were talking about the post-pandemic style. Right now, architects and the folks who are thinking about what goes into a school are asking, what's the impact of our COVID times as we think about hopefully coming out of the epidemic relatively soon? That said, I want us to understand that this conversation around pathogen reduction is absolutely critically important in a world even without the virus. According to the World Health Organization, 30% of new and remodeled buildings have air quality issues. According to the National Education Association, 1/3 of schools exhibit sick school symptoms. And as I already noted, asthma and other respiratory issues are the #1 reason for student and teacher absence. Now, when you think about a sick school, I'm not necessarily talking about an entire building. A sick classroom, a classroom with poor air quality, can be an outlier. It can be one classroom or two classrooms, or it could be all the classrooms in the building. And there are a variety of things which can cause a problem with the air in the building. For instance, in the copier printer room, I could have volatile organic compounds, VOCs. I could have an increase in ozone. I could have a CTE space that has different kinds of dusts in it, or a lab space with pollens in it. I have different kinds of trash containers. And I know that sounds maybe ridiculous, but it's true that I could have something in that trash container, or sometimes even a new kind of trash liner that's giving off something that's causing an activation with a student or with an adult. Lastly, I have things which are oftentimes systemic, like, for instance, moisture. I might have a leak, or I might have a problem with molds or bacteria. So there are a variety of elements. I'm not attacking just one thing. There are a variety of elements that can be contaminating my air, and it could be in just one part of my building, or it could be everywhere in my building. Now, right now, when we think about the current challenge, we have all been working tirelessly to follow protocols. And by the way, again, part of that isn't new. We've always had cleanliness protocols, but right now they're more onerous. I have to note, though, that it's really just one surface, one missed surface, that can lead to contamination. And if we start to have outbreaks again, I don't know if you're following the information around the various vaccines. We know that some of the vaccines, even for folks who have received both shots, they are getting reinfected. We know that there's a really big concern about having students come back to school, and then what happens if those students become asymptomatic and they go out into the community. It just takes one surface to create fear in my community. And I am very, very concerned about the impact of fear on things like enrollment, things like how my teachers perceive the safety of the workspace, how the community perceives the safety of my school. The reality is we just cannot clean our way out of COVID-19 in the same way as we couldn't clean our way out of flu, and we couldn't clean our way out of asthma. If you think about current strategies, there are a number of gaps in the current strategies. One, masks are somewhat efficient and effective. Now they're talking about double masking, but that's really onerous inside of a classroom with students. They can be a barrier to communication. Plastic shields themselves actually collect the virus, or collect different kinds of pathogens. Even if you think about things like UV light and HEPA filters, and I'll talk a little bit later about a case right now that's happening, that there's actually a lawsuit going on because those types of systems are not continuous, and they can even spread things like the virus. These strategies are episodic. And by the way, sometimes episodic is good enough, even though asthma, again, colds and flu, #1 reason why kids are out of school, but it's been something that we have dealt with. But now it seems like life and death, right? Now it seems like there's a lot more hanging in the balance. Episodic strategies are often too reliant on human compliance. So what do I mean by episodic? This is a really super important idea, concept to think about when you consider what it means to reduce pathogens in the environment, in the air. So most systems today bring in air from the outside, and then they take that air and they put it through a filter. In my drawing here, you'll see a MERV 13 filter, and then I have an ionization system, and then the air comes out into the room. And that very moment it comes out into the room, that air is contaminated. If you follow the science that is behind our understanding of the coronavirus, the very first study that came out of Wuhan, China, it was submitted to the World Health Organization to indicate that the virus was airborne, was actually exactly this kind of room. It was a restaurant. And what happened was you had a family, and some of those family members were infected, and they sat at the far end of the room where the air was coming out, that cleaned air was coming out. And that air itself picked up the virus and spread it throughout the room in the same way that pollens and other kinds of viruses, colds and flu, are spread around the room. So even though I felt good, I had a MERV 13 filter, I had an ionization system, those systems let me down because my air was only clean at that moment. And right now, it defines the challenge that our classrooms and schools face. And by the way, many of our buildings in the US were built in the 1950s or beyond. They don't even sometimes have these kinds of systems, right? So I need to be aware of a periodic system. I also need to be aware of, am I counting on a human to do something? For instance, like washing hands. We know that washing hands is only periodically effective, right? And it has to do with the compliance factor. My example here, just basic math. If a method is theoretically 99% effective and I only follow it 75% of the time, then my actual effectiveness is actually less than 75%. So how can I address this issue? It's super important now, but it's been important for a while. And how can I do it in a way that is also sustainable, green, environmentally friendly? Because if you think about, like right now, we have a lot of concerns, more chemicals, it's expensive. Like how many times can a janitor come in to a classroom or whatever? How do I do this in a safe way, in an indoor space, but also environmentally friendly? So I propose to you that we have kind of 4 criteria. Whatever we do to clean the air, to reduce pathogens, it has to be continuous. It has to be active. In other words, the moment that the virus or the pathogen comes in contact with whatever's happening, it has to kill it right away so that the air isn't blowing it around. It has to be safe, right? It has to be safe for humans. And it has to be pretty easy to use because I don't want to have that human factor. So as we look at those kinds of strategies, we actually went out and we started asking the question, what do other people do who are really concerned about these same things, like medical centers, like neonatal units? And we happened upon a really fascinating technology that has actually been around for quite a while, but is just now available into places like schools because the technology has been, if you will, miniaturized, or it's been made adaptable to all different kinds of buildings. And it's called CASPR. CASPR stands for Continuous Air and Surface Pathogen Reduction. All right. And it's one of the devices looks just like that device there. How does this work? Essentially, what it does, what the CASPR technology does, is it does the exact same thing that Mother Nature does. When you go outside when there's been a lightning storm or thunderstorm and you smell that clean air, what's happened there is there's been ionized hydrogen peroxides in the air from the lightning. And the combination of the ions from the lightning, the water and the sun, increase the natural level of hydrogen peroxides and literally cleans the air. All right. Now, you probably know hydrogen peroxide from something that you have under your bathroom sink, but hydroperoxides are literally nature's way of killing pathogens. their technology, the Casper technology, actually is so precise, kind of changes the air or cleans the air as nature does, that it can destroy particles as small as 0.001 microns. And just to compare, if you have a HEPA filter, you might have heard of a HEPA filter, that they can only filter particles as small as 0.3 microns. And this is one of the reasons why things like viruses are zapped, but lots of other things are actually caught by this natural way of reducing pathogens in the air. So essentially, the system takes in oxygen and water molecules, okay, ambient air, and what comes out are these ionized hydrogen peroxide molecules, and they are going to clean the air in a safe way. And by the way, I want to note that this is recognized by the EPA as effective infection control and microbial treatment technology. And that's why it's very often used in surgical suites. It's very often used in medical centers, okay? All we're doing here is we're taking that same natural method and we're saying, I think we should consider how we do this in schools. So the continuous system gets rid of the coronavirus. Again, I'll show you a statistic here from an early study. Recently, just December of last year, University of Wisconsin-Madison found it was 99.99% of SARS-CoV-2 that was zapped. But it gets rid of influenza, MRSA, Listeria, E. coli. You probably know E. coli and Salmonella hangs around on some of our kids' hands. Interestingly enough, mold, fungi, and yeast are also zapped by the system. Okay, it cleans the air of those pathogens. And smoke, volatile organic compounds, remember back to the copier room example, and even some really small kinds of insects are defeated by the system. And this is an early study. I put it here because some people have read about this, so I just want to honor that the very earliest study for COVID-2 was 93.2%. Now it's 99%. However, I also want you to note influenza A reduced over 99.9%. Fungi, again, causing asthma, and bacteria reduced by over 99.99%. So this system, natural system, and most importantly, a continuous system is critical if we think about how we need to respond today to making sure that our air is free of pathogens. So as a follow-up to the presentation today, we'll give you the presentation with the link. You can also have healthcare case studies and education case studies. I suggest to you, because I am not a scientist, I play one on a webinar, but I'm not a scientist, we actually connect you with a scientist or with an educator who's using this kind of system. And by the way, one of the really interesting things about this technology, which was originally developed by NASA, if you can believe it. That's how it's not new. We're just hearing about it now because it's been miniaturized. Yes, there are a part of the system can go in a duct. There's also the Casper Medic system, appropriate for a medical center. The system that can go in a building, or you can even put it on a bus. And right now, it's interesting, after these presentations, we always end up having conversations with folks who have CARES Act money. Of course, there's a lot of funding coming down the pike, most likely from the federal government, to make sure facilities are safe for kids to come back. This is a way to make sure that your air is free of those kinds of pathogens on a continuous basis. So this technology, again, was first developed by NASA in the 1960s, and Casper Group actually received an award from NASA for an innovator in taking that technology and making it available to us, to folks who are working in schools. Again, the folks in the healthcare industry who use it because, one, it doesn't require scrubbing in. Okay, they still do that, but it doesn't require human activity. It's super simple, and it is continuous. Now, I just inserted this slide because this, if you'll notice, this is just from February the 5th. I want you, if you are interested in this kind of discussion and you are looking at other systems, be aware that the systems that are not continuous, that are periodic, are of concern. And actually in Sacramento, this is a real life article from the Sacramento Bee, where there's a school district. They pay Johnson Controls $1.2 million out of a $6 million contract for these air cleaners that were essentially using a UV treatment. It's just that same kind of system I just showed you. But again, the air comes out into the room and it's just going to spread the virus around. Okay. So I said it was from NASA to nanotechnology. The nanotechnology part is a different element, and it's specifically thinking about just surfaces, okay? So not the ambient air, but just surfaces. And as we were doing our research into new technologies to reduce pathogens on surfaces, because if you think about it, imagine trying to wipe down a desk 5 times during a day. That's a challenge. And imagine all the places in a classroom or in a school building that you just might miss because it only takes one. There are a lot. There's this really fascinating new technology called It's Nanode. And this is continuous surface pathogen reduction. And they even have a hand sanitizer. So here's the really important idea for this one. Last time it was about continuous and natural. This time it's about, instead of a chemical kill, all right, a chemical kill might be like an alcohol-based chemical, right, or an aldehyde or whatever. There's the idea of a mechanical kill. And I'm going to show you what I mean by this, but literally the structure of the molecule is going to spear the virus, okay? The reason that they started developing this kind of approach was because they knew that in many places, you just don't have enough time or enough money to continuously wipe down surfaces. And by the way, you think about restaurants or other food handling places, long before COVID came around, right? You have lots of things that, you know, could be a contaminant and could kill you, right? Or could make you really sick, like E. coli. So It's Nanode actually has a protection that lasts at least 30 days. They say at least 30 days because there's actually not a test for longer than that, okay? Or 8 hours on the skin. And the way it works is this. The picture is really the best way to understand it. Imagine that you have this set of molecules, and you have the bottom, which is really sticky, okay? And it sticks to the surface. It doesn't let water in, so you're not going to get mold or mildew, but it sticks to the surface as a molecule. And then it has all these little charged spikes, and the charge attracts the pathogens, and then the spikes spear them and kill them. That's really pretty much what happens. So this is the more scientific example. Again, I told you, next step, right? Talk to a scientist. You might want to talk to a chemist. And we'll connect you with them, by the way, if you have questions, or you certainly get you a test of the solution. Essentially, within minutes of the application, it forms a highly cross-linked, it's called a self-assembling monolayer of hydrophobic, that is, water doesn't like it, nanospikes. So the brown in the picture, the brown layer is that layer that's going to essentially stick to the surface. And then I have these electrically charged nanospikes that literally puncture the bacterial cell wall or puncture the virus envelope and kill it. The great thing about this is that it stays there. It stays on that surface for a long time, but it's not a chemical. It doesn't hurt a kid. You may have heard of some of the studies now with folks who are using a lot of the alcohol-based hand sanitizers. You can actually get a high off of it. It could go leach into your, through your skin. This technology is approved by the Environmental Protection Agency. And by the way, the kinds of things that it kills includes Staphylococcus, also Salmonella, also E. coli, also Listeria. So we think about all the things that I want to make sure that I am getting rid of to reduce pathogens. Yes, of course, SARS-CoV-2 is there, as are these other items. And by the way, it is being used in schools. This is a really interesting reference site if you wanted to talk with them. In Stevensville Public Schools, they actually had an outbreak of the virus in their school, but they were using the It's Nanode solution. And there were no recorded transmissions actually in the school, which was pretty amazing. It's Nanode essentially is shown to reduce asthma. There's a study out of Dubai, reduces respiratory illness. And when they look at, in October 2019, they were looking at a US hospital over 12 months. they found that it reduced the pathogens by more than 36% there, just onto those surfaces. So we're very certain, very confident that by applying the It's Nano to a surface, and again, you can't say forever, but every 30 days, I'm going to have that mechanical kill. So what do? They essentially come into the building. You can apply the It's Nano to all the surfaces, including, by the way, under the surface, right? Underneath as well as on top. That barrier, again, is going to stay for 30 days. And then you also have the hand sanitizer for everyone in the school. If you think about the environment, every single piece of a high impact learning environment is designed with intent. If you look at this Meteor environment right here, every single chair that's been selected here has been selected for a reason, including the interesting stool there, which is actually super ergonomic, but also designed for students who are really high energy because it settles them down. The desk, you see the desks that look like a cloud-shaped desk, are actually designed so that students have access to projects in the middle. We are designing environments for what you can't see. We have to design the environment to make sure that every molecule of air inside of that environment is clean, is sanitized. And that is that continuous air and surface pathogen reduction process, including, by the way, what's on my hands, and that's the It's Nano solution. I want to note that we're very concerned about measuring and understanding the health of every single person inside of a school. So actually, what's on your screen is a real screenshot from a piece of software that we use called Rhythm, which actually allows students to report on a very frequent basis. Are they hungry? Are they sick? How are they feeling? As well as social emotional elements. If we are not well, both in our minds, in our hearts, and certainly if we are not in a well environment, we're not in a high impact learning environment. And that's the big message for today. So the science here, from school to space age cleanliness. We'd like to invite you. You can talk with one of the scientists. You can connect with an educator. This is part of the 14 standards for high impact learning environments. Everything from making sure you have a multi-year strategy and instructional vision to making sure you have expert instructional design and interior design in the design meld, all the way down to material specification, which, by the way, volatile organic compounds, you want to make sure that what you're putting in that environment is not going to activate one of your students, something that they're allergic to, or the teachers, and a well-building approach. I'll get you a copy of the presentation. I'll get you a copy of the report from University of Wisconsin-Madison, but most importantly, I'll get you some contact information so that if you are interested in connecting with someone to learn more about the science and what these systems look like, Meteor is actually offering a free test. If you want to get one of these devices, put it inside of one of your spaces. They will pay for an independent lab to come out, test the environment beforehand, test the environment afterwards, so you can see in your own building that there is a significant, if not 99.99%, pathogen reduction in that space. S. Sanchez at meteoreducation.com. Sebastian is your key person there, and we'll get that to you in an email. All right, and we are right at the half hour, so I will bid you adieu. I hope you find the information interesting, and may have a conversation with you, I hope, with a scientist or educator in tow. Thank you so much, MJ.